What's up, you average lung freaks? My name is Taylor. Y'all know I'm still going hard? I stay killing the inhaler vape game. I keep a whole stockpile in my closet. Just so that I can be the most badass asthmatic there is at all times. Finest albuterol sulfate for this vape queen. My constant inhaler vaping provides me with the lung capacity of a god. Figuring out the correct cocktail for optimum lung expansion is an art that takes a lifetime of asthma attacks to finally perfect. Probably on a stretcher somewhere, struggling, gasping. But until next time, keep inhaling, my dudes. And always remember.
So that was super interesting. Let's focus on our video next.
Okay. By the end of this video, I want you to be able to put one of these chambers and MDIs together blindfolded. You have to do this in 1 minute or less. Okay, obviously I was joking about doing this blindfolded. My wife thought I was a total geek for making that video, but I thought it was funny, so I don't really care. Traditionally, people have used it this way. Put it into the mouth, try to inhale in, and try to get some type of effect. But what most people are doing is just spraying the back of their throat. And that's not the desired location for this medication to work. So I encourage you all to use a chamber appropriately. Initially, we have to put everything together though, because this comes into the package like this. So we have to make sure this drug is not expired before we put it into this. And on the side of it, it tells you how many micrograms per spray it is. All right, so this is our aero chamber. And our MDI goes into the side right there. Slides snugly into place, make sure that's nice and firm. And this is your mouthpiece here. Inside, it has a one-way valve so that when we breathe in or spray the medication, we can inhale that medication at the same time as when we spray the medication into it. The thing to consider is this indicated for the right patient. So we think of the 7 rights of patient medication administration. Let's review the 7 R's really quick. We got to make sure we choose the right drug. The right drug for asthma, COPD, or things like wheezes with bronchospasm is, for example, Ventolin. Ventolin is given through this metered dose inhaler at 100 micrograms per spray, and we're allowed 4 to 6 puffs. So that's 400 to 600 micrograms for a dose of this medication. The right time. Obviously, if it's indicated and we need to give this medication in the acute setting or the sudden onset occasion, we need to give it at the right time. And the right dose. Make sure that it's either an adult or pediatric dose. In this case today, our examples will be adult doses. And always confirm that you're giving it to the right patient. In the other settings, other than the hospitals, we generally have 1 patient sitting in front of us. Make sure it's the right route. Obviously, for this type of medication that's inhaled, we are not giving it IV, we're not giving it IM, or orally, despite the fact that some people try to make this an oral medication. And then the other R's have to do with the right documentation. We already talked about having the right reason. Check with our patient that they're not allergic to this medication called Ventolin or Atrovent. Not expired, we're going to give it through our meter dose inhaler. Connect it. This is the mouthpiece. And we're going to get them to sit upright, look at us, and we're going to hold this towards the face. So not upside down, or off to the side, or down like this, or up like this, directly like this. This is the best route for that inhaled medication to get from here right to the lung field. That's not too complicated. So we're going to time this at the right interval for when our patient is inhaling. One of the first things we can do with these medications is time them. So we just do 2 sprays away from us, okay? It needs to be shaken as well. So we can shake it on its own independently from the chamber, or you can attach it and shake it this way. and it'll disperse the medication within the amount of fluid that's in there. We stand it upright, lips around the mouthpiece, and inhale our medication. Did you hear that little sound there? I'll do it again. You know what that indicates? It means I'm inhaling too deep and swiftly. So I need to relax that a little bit. So in between sprays, we wait about 30 seconds to 1 minute. So you can see if we're doing 4 to 6 puffs of this, we could also do 4 to 6 puffs of Atrovent at the same time. This may take considerable time to accomplish this skill. Just use this, and you inhale that medication. They can hold it in for about 10 seconds before they exhale. Wait another 20 seconds, and then they can have another dose of this. But I encourage you to use the chamber. Way more effective. It's been proven. So do it. Waited almost a minute between the sprays. We're going to teach you the right way to inhale this medication. We don't want to hear that sound. It's called tidal breathing. 2 to 3 really good regular breaths, and then all the medication will disappear from this chamber. Didn't hear that sound that time, did you? All right, that's the proper way to give it. Wait another 20 seconds, and you can continue to go on with your 3 to 4 more puffs as required. The key with the tidal breathing is to breathe in slow and deep. Right? These are all instructions we want to give to our patients ahead of time. Sometimes we leave patients at home. We need to give them good instructions. I find a lot of patients do not know how to use puffers appropriately. So I ask them to do it in front of me. Show me how you're using this medication. Oftentimes we can provide correction to them at the right time in their homes. Right? The other drug we want to talk about briefly is Atrovent, which could be used in unison with fentanyl. But if they're hypersensitive to it or allergic, obviously we cannot give Atrovent. All right, follow the local protocols and procedures you have in place for the service that you work. We'll meet you in lab and we'll practice this together and get ready for a sign-off.